as well as they come out of the problem of the digestion, indigestion, right?
Yes,
Especially
sir.
the constipation, right?
Yes, sir.
Okay, right.
Sir, can we recommend it to children?
Huh?
Can we recommend
Yeah.
it to children?
Yeah. 100% you can recommend to the children, but reduce the quantity. Don't give 30 ml.
Okay, okay.
Give 10 ml, 5 ml. If a small baby, give 5 ml. Okay.
Okay, okay.
According to the age, you can give 10 ml, 15 ml, 20 ml. For
Okay.
adult only, 30 ml is recommended.
Okay, okay. Got it. Thank you, sir.
Okay. Can we go for the next product?
Yes.
Yeah, we'll go for the Diaba Care.
Okay.
Going into the product, we'll discuss about the diabetics. What do you mean by diabetic? Diabetic, somebody can mute, please. Some noise is coming out of that. Can someone mute, please? Yeah. Regarding that, if a person is a diabetic, what do you mean by diabetic? Diabetic is not a disease. Underline it is not a disease. Like what do you call virus infection, bacterial infection, like that. It is not as such. It is a disorder. What do you mean by disorder? The pancreas is not producing properly the insulin. That is called beta cell. The beta cell will be converted into insulin so that the secretion is not adequate. It is not fully adequate. It is insufficient. One is it is not at all secreting. Another one is insufficient. Another problem in the human body is that insulin is secreted sufficiently, but the cells of the particular person is resisting the insulin. It is not accepting the insulin. It is resisting the insulin. So it is called insulin resistant. So these are all coming under the category of the diabetic. So diabetic is not a disease. It is a disorder. How to overcome the disorder? Number one, controlling your diet. Avoiding the most of the carbohydrate and the unwanted, what you call junk food. Avoid the junk food, and you have to take the proper food. Especially you have to take more vegetables. Food habit. Number two, that you have to avoid the sugar. Sugar is coming under the carbohydrate. You have to avoid that. You have to reduce or avoid totally. Number two, that you have to do the exercise. You have to do the exercise. Proper exercise. Especially the walking or yoga, or you are going for the gym. Okay, do it every day. The exercise to be done. Next one out of this, the most important thing is the medication to maintain the sugar level. So I told you the diabetic cannot be healed or cured. It cannot be cured. It is to be controlled. How to control? To maintain the sugar level in the body. How to control the sugar level? That is concentrating on your diet. Number two, exercise. Number three is the medication. In modern medication, you will get, you take an English medicine that you call allopathic. Allopathic means English medicine. So in English medicine, what they are giving is the very, the price, the tablet price is very, very low. But the insulin price is very, very costly. But the tablet price is very, very low, very, very cheap also. But it got its own side effect. What is the side effect? Suppose just we are taking, yeah, I'm telling just for an example. You are taking allopathic English medicine for sugar, just for a diabetic patient is taking 50 mg is taking. After a long run, the 50 mg will be enhanced to 75 mg. Then it will be enhanced to 100 mg. 100 will go 150, 200, 300. One fine morning, if he is not maintain everything properly, only is depending on this medicine, it will lead to insulin. And also, he will start with a very, very small quantity of the insulin. Then, every quarter, every half yearly or yearly, he has to increase the insulin. It will lead to the complicated problems. And also, when you are taking this allopathic medicine for the diabetic problem, you will feel some uncomfortability in your body, especially in the nervous system. They will say The diabetic patient will say, I got the numbness, I got this problem, that's problem, my skin is not okay, right? My stomach, digestive system is not good. They will make so many complaints. All will come by taking the allopathic medicines. When a person actually, when a person is having sugar level is so high, he has to undergo allopathic medicine immediately. That is for the emergency medicine. Allopathic medicine is an emergency medicine. He has to take that medicine and he has to bring the sugar level to the control. After that, to maintain, and every time he has to maintain the sugar level. For that, he can depend on the herbal products. What the herbal products will do, it will support to maintain the sugar level, not on the next day. In a long run, the sugar level can be maintained very easily. They will not have any side effect. Once the sugar level is maintained in the human body, diabetic is not at all a problem. If the sugar level is not maintained properly, that is, diabetic is not controlled, it will lead to all the complications in the body. So what the scientific field says, diabetic is not a disease, but it is the mother of all diseases. Underline, diabetic is not a disease, but it is the mother of all diseases. So it will complicate all the things. So at any cost, the sugar level to be maintained properly. To maintain that, herbal product is very, very safe. For that, our Diaba Care will play a great role in that, because it is purely herbal based capsules. Okay. I want to tell you about this. I discussed about the digestion. For digestion, I discussed about digestion syrup. But in Diaba Care, along with the Diaba Care, you have to recommend sea buckthorn juice compulsorily to the diabetic patients. Because yesterday I discussed with you, sea buckthorn contains omega-3, 6, 7, 9. This is an essential fatty acid. This is essential fat is very, 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 very important for the diabetic patients. So that they have to take sea buckthorn. If they take in the sea buckthorn, in diabetic patients, what they will say now, whenever they are taking the fish, they will say, my sugar level is reduced, I'm in control, they will say, whenever they are taking the fish, because the certain fish contains omega-3, not all the fish, certain fishes contain the omega-3, but our sea buckthorn contains omega-3, 6, 7, 9, so that it play a very, 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 very vital role in diabetic. So wherever you find the patient of diabetic, wherever not, you see in every family there is 1 or 2 people are there nowadays, right? The diabetic is very, very common in every house. In future, I'm telling you, another 25 to 50, another 50 years, everybody will be a diabetic. That will be the problem. So you concentrate in this. You recommend not only the Diaba Care capsule, you recommend compulsorily, you recommend sea buckthorn. Ask them to take sea buckthorn as well as take this capsule. If both are combined together, that is omega-3, 6, 7, 9 sea buckthorn as well as this herbal based Diaba Care will play a great role in the human body. It will control the sugar level. It will help the body to maintain the sugar level. It may be a insufficient insulin secretion also be managed by these 2 products, as well as the sugar level can be controlled by another way. That what we are saying is that insulin resistance. The insulin resistance can overcome by this, right? So you have to tell to them Diaba Care along with sea buckthorn. That is very, very important. Any questions? Any clarifications? Hello?
Yes, sir.
Amit?
Yes,
Yeah.
sir.
Yeah, somebody
Yes,
to
sir.
raise the question. Somebody to raise the question. Then only the session will be
I have a
interesting.
question for this Diaba Care and Sivaktam, because I am taking regularly this and I am the patient.
Are you taking the sea buckthorn along with this?
Yeah, I am taking Sivaktam and Diaba Care regularly.
All right. How you feel?
I feel nice. I don't take any doctor medicines like this English medicine. I am not taking any medicine. From
Very good.
last 6 months, I am not taking any medicine.
Okay, right. Have you checked the sugar test?
Yeah, it's
Your
same
blood test?
as usual. It is same.
Same.
Same, not goes up, not go down also, but it is regularly it is same.
Okay.
I always
Okay.
check in a week.
Okay. That is one more point I want to discuss with you. That
Yeah.
is when you are taking the allopathic medicine for diabetic, sometimes the sugar level may come down. Automatically, it will come down.
Yeah.
When the sugar level goes, when you are taking the tablet, it will come down automatically. So that you have to take some extra coffee or anything, you have to put the sugar add. See, when the sugar level come down, the solution is that you have to take some sweet immediately.
But by
This will
taking
happen. This
by taking this Diaba Care and Sibactam, I used to eat sweets. I eat
Baba,
everything.
hello, I will not advise all those things. Okay, that is body
No,
to
I
body,
eat
it will
everything,
differ.
sir. I don't know,
Eh?
but my sugar level is as it is. Whatever
Okay,
it
okay.
is, it
That
is
is
same.
the main point I want to discuss with you about this is in allopathic medicine, the sugar level will come down. That is, it will go below the normal. It goes below the normal, it will create complications in our body. So, when you are taking the Diaba Care along with Sibactam, the sugar level will be maintained in a normal level. It will never go down. Suppose your sugar level to be 95 or 100, you can say. When it is 100, it will be maintained in 95 to 90 to 100 only. It will not go to 70, right?
Yeah.
That is the specialty of the herbal product along with the Sibactam. That you note down the point. That is very, very important. See, in diabetic, I tell an example. In diabetic cases, certain people, they will take some more insulin extra, or the dose may be normal. Sometimes the sugar level go down immediately. They will have the hiddiness. They will feel uncomfortable. Then they will lead to coma stage also. There are so many cases like that. That's why in the starting itself, you control your sugar level by Sibactam and Diaba Care of the herbal product. Both combination is very, very, very good combination, right? It is just like an husband and wife. It will work very nicely. It will give you the result for the diabetic patients to maintain the sugar level.
So we can take 2 times also this in a day.
That is according to the sugar level. Okay, if your sugar level is high, you can take 2 times, right?
Okay, sir.
If your sugar, by taking in the morning dose itself, if you feel comfortable, then leave it. If you are uncomfortable, you feel something sugar level is going high or something, you can take before going to bed also. Second dose.
Okay, sir. Okay, sir.
Any questions about this? This is a very, very important product because you can sell in every home.
Yeah, nowadays sugar is
Yeah,
80,
you see, diabetic patient
80%
everywhere, in every home, the person is there. So that when you are going over there, whether you are selling the acai berry or whether you are selling the other items or not, but you can sell the diabetic product. The combination of Sibactam with our herbal capsule, Diaba Care.
Okay, sir.
Okay, can we go for the next product?
Yes, sir.
Next one, we can go for the joint care. See, when the people started to age, there will be a damage or depreciation in their joints. Not only the knee joints, as well as the ankle and other areas, wherever the joints is there, the pain will be there. That is because of the secretion in their body, as well as the weakness in that particular area. To support that, we need definitely the herbal products to compensate that, to come out of the pain, to overcome the pain, to overcome the insufficiency of secretion in the joints. See, what you are doing normally when you are having a bike or car, or you take a bicycle. In bicycle, what you are doing, just you are taking an oil can, you are putting the oil in the cycle chain, the rolling areas, to maintain smoothly. When you are going in two-wheeler, Along with your petrol, what you are doing? You are adding the engine oil. Along with that, you are adding the engine oil. In the four-wheeler, in the car, diesel or petrol is separate, but there is a separate tank is there, putting the engine oil. So the lubricant is very, very important. So in our case, the herbal product of our joint care, what it will do, it will give the lubrication to your joints. So after, 1 week or 10 days or within a month, you will feel comfortable in your joints. Right, I'm not feeling that much of pain. Because one side, it is reducing the pain. How it is reducing the pain? Number one is giving the lubrication to the joints. Number one, the secretion will be increased. So your damage will be very, very low. So you will feel comfortable. You will not feel much pain one side. Another side, it will act on another painkiller. It will act as a painkiller. It will reduce the pain. Two ways it will reduce your pain. In a long run, if they taken the our joint care regularly for years together, they will, if their food habit is perfect, they will come out of all the joint problems, because our product will work naturally in the joints. If that, okay, if they taken the allopathy medicine, English medicine, what will happen? When they taken this, the pain will go immediately. Not like ours. Ours will take natural, it is a natural way, so that it will take its own time. But in allopathy medicine, immediately the pain will go. But in a long run, they will have the problem of gastritis, indigestion, peptic ulcer will be formed, especially the peptic ulcer will be formed. And they have to increase the medicine dosage. That is the main side effect. Once the stomach become upset, what you are going to do? You cannot eat properly. You cannot take the masala food. You cannot enjoy your nice food with masala. You have to take only with salt and pepper. You have to take the blunt diet. What is the use of that? Only you have to take curd rice or rice with buttermilk. What is the use of that? Only way that if people, those who are having the joint pain, if they depend on our product, our joint care will take care of that. One is by lubrication. Inside, the lubrication will start to lubricate. We are not putting any lubrication injection, but the lubrication, natural lubrication will start itself from the body. It will increase that. It will induce that. Number two is that it will reduce the pain. Slowly, it will reduce the pain in a natural way, altogether without any side effect. That is very, very, very important. Yeah. Yes, your questions, your doubt. We'll clarify your doubt.
Sir, what about gout and all? Uric acid, uric acid, uric acid.
Uric acid, it will not work up to the optimum level. It will work, but it will not work up to the optimum level, right? They have to reduce the uric acid secretion, right?
Yes, sir. Yes, sir.
For gout and all, you can recommend Cibactan also.
Cibactan, sir.
Cibactan, if he is not a diabetic, you can ask them to take acai berry.
Yes, sir. Yes, sir.
And,
thank you, sir.
One more thing, very, very important. Now we have to make, see if they got a simple joint care problem, ask them to take this. If they got some complicated problem, ask them to add the Cibactan, because the omega-3 will work all the inflammation areas. Another thing you can recommend, if the particular person is not a diabetic, ask them to take acai berry shot. They'll be active, they'll be so comfortable. Out of all those things, ask them to take the spirulina.
Yes, sir. Yes, sir.
Spirulina is an anti-inflammatory.
Sir, diabetic can take acai berry.
See that acai berry can taken if their sugar level is within 200.
Then he can take, no?
Within 200, they can take. If it is beyond 200, I'm talking about after food, okay? After food.
Okay.
If it is 200, they can take. If it is above 200, no, not advisable.
Okay.
See, acai berry will not induce the sugar level to the immediately. It will not shoot, right?
Yeah.
It will not add another 100, 200. No. It will not do that. It will do 20, 30, 40 only, right? It will go slowly. But the concerned person will feel uncomfortable. He will say, no, because of this acai berry only, I got the my sugar level is gone up. It is not as such, but better diabetic patient within 200 after food. I'm not talking about the fasting. Before food, after food, if the sugar level is within 200, they can take the acai berry. If the sugar level is more than 200, the best way is to avoid.
Okay.
I will tell you one more solution also, right? Hello?
Yes, sir. Yes.
If the diabetic patient can also take acai berry, how? Along with the Imu5n, along with our Diaba Care capsules, they can take Imu5n also, right?
Yeah.
It will be maintained. It will be maintained.
Sometimes I take Diaba Care and Imu5n, and sometimes I take acai berry also.
You can take acai berry once in a while. You can take acai berry. That
Not
is
regularly.
one shot a day. One shot a day. One shot a day you can take. But along with this.
Okay, sir. Okay, sir.
So, can we go for the next?
Sir.
Okay. So,
Yes.
next one is the Imu5n capsule and drops. Both I'll discuss both the things. Okay. What is the common insight? See, the immune capsule is purely for the adult. Adult people can take Imu5n capsules. Children's are advised to take the immune drops. We can take Imu5n capsule as well as drops, but the children are advised to take only the drops, not the capsule. Right. See, Imu5n, the name itself shows that it is an immune booster. It will boost your immune system. When your immune system is strong, any bacteria, any virus, any other foreign particle entered into your body, immediately it will crush, because our white blood cells immediately will go. It will catch that virus, bacteria, and it will kill on the spot itself. That is the work of the immune system. If your immune system is strong, it will do that immediately. That is, you take a country, India. Okay, you can take the India and Pakistan border. When our Indian army is very, very, very strong in the border, the Pakistan cannot touch. If they touch immediately, they will shoot immediately. Finished. Because our army system is very, very, very strong. That means I'm talking about the army, whether it is a battalion or navy or air force. All these combined together, very, very, very strong, so that other person cannot enter into our border. The same way, in our body, if unwanted element, that is called virus, bacteria, whatever you name it, or fungus, whatever it may be, when it is tried to enter into that, this immune system acts as like an army, and it will kill that immediately. Suppose if the army is weak, automatically the enemy will enter into the body, right? Our product is some Imu5n capsules, drops, or a product of immune developer or immune booster, whatever you are saying. Okay, right. Especially I want to discuss with you about this